Welcome to Clinic Services Best Practices in Practice Management. Today I have the honor of being joined by Dr. David Conway, Managing Doctor of Littleton Internal Medicine Associates, also known as LIMA. Today we will talk with Dr. Conway about learning some of the best practices that he uses in order to run one of the most vibrant practices in South Metro Denver. Dr. Conway, in 1999 you joined a very vibrant practice. During that time you've risen to become the managing doctor. What has changed about being a doctor during that time?
There are so many things. It's really been a major time of change, and medicine is really far different than what I pictured going in. I'd say the biggest thing is, of course, electronics and how we interact with patients. When we first came in, we were still using paper and charts, and we're piles of charts this thick, and now it's all converting to gigabytes. It's a big change over time. It can be a great change for us. We're still midway through that process. Then, of course, it's how we're representing our care with the government, and care and accountability for that care as well, which is really a big change over the years as well.
How about from a managing perspective? When you joined the practice, you were a doctor, just one of the crew. During that time, you've risen to lead the organization. What's different from being a doctor in the support role as opposed to being the leader of the organization?
My first few years here, I was, of course, just a new physician and an employee, and you're just learning the ropes and just making it through your day without trying to kill somebody, which I did successfully, and we've moved it forward, and
good.
And I have some interest in some of the financials, and took more of a leadership role in the practice, and really it's been a real learning experience. Medical school doesn't teach you anything about the business side, including coding and certainly how to run a small business. That's really
the
been
people management aspects have been challenging.
Absolutely.
Yeah. And what do you do in order to overcome that, to build a culture that performs?
Certainly having a competent practice manager to help us oversee that, but trying to pay attention to business practices, and pay attention to employees and how they're being treated within the practice, and helping support them, helping them have the tools they need, both as far as morale and technologically, is very important.
So your role is really to set the tone and the pace in the organization, and then to hire competent staff and give them the opportunity to succeed given the environment that you perform in.
That's a good summary.
Good.
Yeah. So another thing that's changed over time is when I first came into medicine, medicine was more of the traditional model. It was just the physician, and then everything is decided by that physician. Everything goes through them. Whereas medicine has evolved over time too, so that we're evolving to more what's called care teams. We have the MAs, PAs. Each care team is taking care of patients, and it's not just the doctor's responsibility to be looking after our patients, but everyone on that team. Diabetics, they need their regular testing and all this. It's we're moving towards having the people on the phone as they answer. They're looking it up, and you're due for your diabetes blood test. Things like this. Everyone try to help take ownership.
Proactive notification of ways to help the patient achieve better health results.
Absolutely. When I first came into medicine, it was more, okay, I'm the doctor, you do what I tell you. If you don't come back in 6 months, that's on you. Whereas now medicine is switching more towards the nurturing side of that. We're going to help. You haven't been in. Let's make sure everything's okay. Let's track that, and certainly electronic records have been hugely helpful with getting that to happen.
This kind of tees in, not only obviously you're running a very vibrant practice, but as we've discussed, you're also very active in some of the different physician associations around town. How have you, as both an individual as well as a practice, adapted to some of those national and state reforms that are going on to improve the efficiencies in healthcare?
It was something that certainly those legislations help your thinking along, and I think there's some good that's coming out of that. Some of the those measures, the looking out for patients and trying to look out for their health, and then going ahead and as far as joining accountable care organizations, things like this, has really helped us to focus on getting these patients taken care of in these roles, and also how to navigate, you know, these changes where we're going to have to be showing, you know, that we're showing quality. That's certainly the trend, and you know, if the practice isn't doing that, then the practice is in trouble.
In your relationships with these physician associations, you're on the board of at least one that I'm aware of. What do you all discuss at that group level about ways that you want to improve the healthcare outcomes for our community?
Yeah, it's all about, you know, quality as well as cost control. You know, cost has gotten out of control in our healthcare system, so that's of course one major aspect. But it's kind of a dual issue of trying to reduce those costs and improve quality, and that's where I've been really excited to be part of a physician-run ACO. I think that's a very important thing, that it's, you know, as we're pruning back networks and as we're, you know, trying to keep people out of the hospital, we're doing it with physicians in charge of making those decisions and determining those networks and determining how those policies get put into place. And at this point, it's really been very beneficial.
How has that peer collaboration helped you practice medicine back at your individual practice?
Well, it's also nice that we, as a doctor, you tend to, you know, we practice in our own isolated area. So that's really brought doctors together within our community as well. We have regular meetings, regular educational meetings, and, you know, just even social get-togethers with our primary care physicians as well as other specialists. That really allows us to talk, interface, as well as troubleshoot issues we're having within our own practice. I think it's brought us together as a community.
Littleton is absolutely a healthy community. It's an area where the hospitals and the YMCAs and the Park District all collaborate on the health results, and your frontline doctors are right in the heart of all of that. So we really appreciate all of your efforts in getting that done. As a citizen of Littleton, I'm grateful to have good medical care here, so thank you for being one of those folks for us. What advice would you give a newly graduated resident that was interested in pursuing entrepreneurial medicine?
Yeah, I would just say that it can be scary. Being an internist, you know, most people are in training. They're just used to what goes on in the hospital, so it's just the hospital rounds and all. And it's stepping out of the box. Usually the outpatient medicine is more where that entrepreneurial side would be, as opposed to being a hospitalist and, you know, doing primary outpatient care. And as far as that goes, we're really, don't be afraid. You know, a lot of people are afraid of taking that step, and boy, there's so much to it. But you know, be surprised what you can do over time. And it also gives you some discretion over your own direction you take as a physician. I've talked to some other providers that, you know, have not been as happy with being employed, and having that control over your destiny really feels good.
You know, jumping off the entrepreneurial cliff in any business is very difficult to do in a very scary environment. So creating a landing pad where these doctors can excel and perform in the way that they're trained is a great benefit. What steps do you take to bring on a new doctor that joins your organization so that they fit and perform as quickly as possible?
Well, we really, you know, try not to do the into the fire approach. You know, we start out easy, more of a mentor relationship. You know, bringing them into that care team. I was talking about with a physician, PA, MA. You know, have them be a member of that team. You know, not have them be the head of one of those teams. They'd be slowly, as they're accruing that knowledge and skill set. Because outpatient medicine really is a whole different ball game, and you've been taught maybe half of what you need. You know, you're taught what happens in the exam room. That's certainly not all of the game to medicine. And over time, you know, I think people are surprised at, you know, how functional and how relatively easy and rewarding it can be. That's the big thing I like about outpatient internal medicine, is the rewarding the relationships with people, you know, knowing people over decades, and helping them in their care and making a difference in their lives.
Your office is located on one of the campuses of one of the larger hospitals in the area here. What benefits have you seen being on the campus and in collaboration with the health system that runs the hospital?
I think it really helps for that community sense, talking with other specialists, having that connection with the hospital. We used to be doing a lot of hospital work in the hospital, but at this point we focus more on outpatient medicine. Still very useful for us to be close in conjunction with the hospital, with the access to specialists and continuing education, these types of things. It's really a nice place for us to be.
In 1999, Littleton Internal Medicine made a decision to outsource their billing efforts. You talked earlier about some of the complications and things they don't teach you in medical school that you learn by that trial by fire you'd mentioned earlier. What led you to the decision to outsource, and how has your practice changed since you've made that decision?
We used to have our own in-house billing group, and they were all certified coders, and I think a lot of it is like we were talking about with the ACOs, that there's you're isolated as you're there as a single group. You have sometimes you get in your own routines and all this. And our coders were good, but they were extremely busy, and I don't know that they were able to keep up with a lot of the changes in coding and all this. We'd be waiting for rejections instead of hearing about things more proactively with billing and all this. And being busy and trying to keep our overhead down, we maybe were a little understaffed as well. Mm-hmm. Our accounts receivable were getting out fairly far. There were a lot of things that we were just writing off at that time too. So we took a closer look into it and talked to some other groups that were around, and found a great option we've been very happy with. And over time, that's really helped us out. We have a little more of that sense, that proactive look. Okay, we have a good team that's our team. With your service, and
mm-hmm.
They'll be able to tell us, okay, here are some of these changes coming. They can also tell us, okay, these are some things that other practices are doing that we see you not utilizing as much. And also, these are things that you may want to consider adding as extra revenue,
mm-hmm.
As well as the accounts receivable has been much more favorable as well. We're getting better returns and more quickly than we were able to do with our in-house service.
The acceleration of cash flow certainly makes it a little less stressful to just manage a day-to-day business, meet payroll, and just general small business demands that hit you.
That's true, and we also like that you're able to give us some details about how we're comparing to other practices as well. Although there aren't specifics, we can get an idea about, for example, are we on par with using certain codes? Are we an outlier? Could we be somewhat at risk for being evaluated for an audit? Are we within the community standard? That gives us a little more of a sense of security as well.
Mm-hmm. Given that there is, in an outsourced relationship, a barrier between a physical location of the provider as well as a physical location of the service, what kind of information is important to you that we make sure we get back to you on a timely basis, on an intelligent basis, so that you can make business decisions? What are things that you look for from us?
There's certainly a lot of data, and I like that there's you provide access. We can get the 100-page report, and but you also have some nice summary pages. And over the last year, you've developed some nice other summaries that have helped in more of a graphical representation, mm-hmm. and that's really enhanced our understanding and actually our ability to take a look at differences within our organization more at a glance. So having that information quickly and on a regular monthly basis and reliable information, that really has been very helpful.
Payment reform is a hot topic coming on. There's a lot of move toward bundled coding, fee for performance, and other quality initiatives that are out there. How has that changed the way that you do your documentation, work with the patient, and generally manage the practice?
It's really a dynamic, changing landscape, and that's the big issue. Being able to keep up with those changes, having your organization looking out for changes in the billing and that side of things, but also being part of a larger organization. It's difficult for a physician organization to be on their own in this current climate. So being with an accountable care organization, grouped together with other fellow primary care doctors has really been paramount to helping out with those issues and allowing us to stay moving forward as far as that payment reform. Everything is coming to, are you part of one of these groups? Are you able to show that you're meeting these quality measures? And that's what it's all going to be about. Is whether or not it all always seems relevant. We need to show that we're meeting these standards that are being chosen by the powers that be, and we're confident we can meet that. It's just having the flexibility as well as the technology and the support to make that happen, to succeed in the future.
What are the biggest challenges you see facing a private practice today?
I'd say it's the changing landscape. And I'd say the hard part is changing while you stay the same. Right now medicine is changing at a blistering pace. We've gone from capitation to free for all, fee for service, and now we're accountability in care, and we're going full circle, and we're needing to show the government, insurance companies, the qualities that we measure. We have a computer in the room that we have to look at the monitor and intervenes with our relationship with patients. The main thing though is to remember that it's the doctor and the patient, and that's what matters, and that's where, as all these changes happen, we need to keep that focus, doing what's best for that patient and doing the best we can to deliver that quality health care to meet their total needs. That's where we need to go, and our practice is really striving to maintain that and keep that as our guiding philosophy.
Back in really 2010-11, a lot of practices sold out, became part of larger health systems. What enabled you to stay independent, and what is going to allow you to stay that way moving forward?
Well, being a busy practice, certainly trying to control costs, being in a good location like we are, and having that flexibility to be able to be dynamic and change with the market trends and where the market is driving things. There were a lot of offices that did go into the hospital, and we're very happy we've been able to stay independent. Plan on doing so for the long term.
We'd like to once again thank Dr. David Conway for joining us today on Clinic Services Best Practices in Practice Management. Dr. Conway, thank you for joining us.
Thanks, Andrew.